Hey, it's Alvin Brown with Massage Training Plus. I'm here with Joe Palumbo. You've seen his name in the forum. And so today what I want to do is I want to give you a quick tip, really quick, on how you can address the cervical spine to affect the muscles in the upper extremity, right? So what we're going to focus on is the nerves that run from the cervical spine and go to three muscles. What we're going to look at is the deltoid, the tricep, and the infraspinatus, one of the rotator cuff muscles. So, and I'm going to show you how massage can help to restore those muscles and get them firing again. Now, I don't know if Joe will have what we're looking for, but I'm just going to give you the idea of what we're going to do today. So, and remember, when I do this, the correction that I do will be a quick correction. It won't be the extensive treatment that you'll be doing, so the fix that we get will be temporary for now, but you'll get the idea. So here we go. What we're going to do is we're going to do our first test. The first test is going to be the deltoid muscle. Now the deltoid muscles, they come from a nerve in the neck, as some of you may know, but if you don't, I'm going to remind you again. They come from a nerve in the neck, for the fifth level in the neck, the fifth cervical nerve, so C5. They innervate the deltoid. Now the next one we're going to do is the triceps, C7, and then the infraspinatus, again C5, C6. Those are the nerves that innervate those muscles, and those are the ones we're going to address. So let's start with the deltoid muscle. The testing we're going to do, we're going to have Joe go to a level plane with the deltoids, the arm, forearm, and elbow flexed to 90 degrees, turn parallel with the floor. And all we're going to do for that is we're going to apply pressure downward, and Joe is going to resist me. Hold, Joe. Good. Nice and strong. Now when you do the testing, remember, you don't want to be fighting with your clients, so don't have your clients push up or do anything extra. Just let them know, don't let me move you. Simple, you put them in the place you want them to go, and don't let me move you is the instructions you give them. So the next one, that was deltoid. Next one we're going to do is a tricep. Now tricep, again, palms turn to the ceiling, so you're supinated, and all we're going to do is we're going to apply pressure that will close the angle on the elbow. So pull it towards him, and all Joe's going to do again is don't let me move you. Joe, hold. So tricep on the left is weak. Okay, so we're going to make a note. Tricep, left tricep weak. So something in the lower neck, the C7 area. Next one we're going to check the infraspinatus. Again, parallel arm, elbow 90 degrees. Support the elbow with your palm. Your elbow is on the outside of his back to create a fulcrum, and all we're going to do is your pushing hand is going to push him in this direction. So that's all we're going to do right now. And so Joe, don't let me move you. Hold, and nice and strong. Now we're going to go on the other side, and let's check this one out. Same thing again. Support the elbow to his shoulder blade, and all we're going to do is we're going to push forward. Joe, hold. Good, nice and strong. So those were the three muscles we're going to check, and all we found was this left tricep. Now we're going to do the correction. Now I must make a quick note. When you're testing, listen, it's not me against Joe. I'm not trying to beat Joe. All I'm trying to see is, will his nervous system allow him to resist me? And if it does, I stop the test, and it's a strong muscle. We won't try to beat him. Now, Joe, I'm going to get you on your back. Now we're going to go into the corrections. So for the corrections, stay tight, stay wide. For the corrections, all we're going to do is we're going to, typical lotion, we're going to do a massage on the neck, but our main focus is we're going to focus on opening up the scalene muscles, the fascia through the neck, the upper trapezius, and we're going to get right in there where that nerve comes out and it goes to supply those muscles. So here we go. Now I must make note that the issue is on the left side, but for the sake of the camera, I'm going to do a little work on the right side, and that will give you the idea. Then I'm going to work on the left, and you'll get the idea. You'll put it all together. So from here, what we're going to do, we're going to get our lotion. We're going to apply the lotion inside. We're going to get right in there, and again, opening up the fascia through the scalenes, the SCM muscle, the sternocleidomastoid, the upper trapezius, and we're going to get right into the neck, into the triangle in here, and where that nerve courses down. I'm just going to open it up so it can be free, liberate the nerves so they can fire properly. And then we switch sides. I'm going to switch. Okay, so all we're going to do is on that left side, going to do the same thing we did on the right. Again, just opening up that triangle, getting into those muscles where the nerves course. And in this case, you might want to grab your anatomy book. You can go on the internet. You can Google that brachial plexus, that triangle in the neck, you know, and see where that all comes through. The thoracic inlet, things like that. You can just Google those for now. In our course online, we will go over all these structures and get you up to speed. But for now, with this quick tip, you can Google that. So that's all we're going to do for that. Now I'm going to show you a quick stretch that you can apply after working on the soft tissue. And the stretch will help again to liberate the muscle. So all you're going to do for that stretch is you're going to post up, block Joe's shoulder from going with you. If I don't block it, his body comes with me. What I want to do is I want to block him in, post down to create that fulcrum. And again, I want to take Joe's neck to the opposite side, and you can see that neck is getting a good stretch in there. And then you release. Now I would do the same thing on the other side. Now for the sake of the camera, I won't take that same angle, but we're going to take it over, block, and stretch. Good. All right, Joe, get you have a seat up. Now remember, that was a quick, more extensive work is needed to keep the correction. That was a quick adjustment, quick. If you work with a chiropractor, again, you can do your soft tissue work, send them over to the chiropractor, osteopath, whoever does the joint manipulation. If you know extra techniques that you can do as well, you can apply. But soft tissue work, stretch, and then I want you to go back and I want you to test that muscle again to see how it is. So here we go. Go, resist. Good. Okay, so again, it's firing. I don't want to, again, it's not me against Joe. I just want to see how his muscles fire. As soon as I ask him to resist me, it should be nice and quick. The nervous system shouldn't delay. It should be nice and quick, and you should see your test should be positive. Now again, that's a nice, short, quick, objective measurement that you can do for your clients and for you. It'll increase the value of what you're doing with the massage therapy, and again, this will increase your referrals. Everyone will start to see the magic of what you do, and again, it just adds that professionalism to everything that you're offering. Again, quick tip, thank you for again joining us for 2012, hanging in. And this is to the community, so you can enjoy what we do. More of this, we'll get into more depth as we get into the programs in 2013. We're getting ready to roll it out now, and you should have emails coming out about our program starting up, and we're super excited to give you more of this. We'll go more into depth. Joe will be here. Joe will be giving you a quick tip next week. We're going to send out a quick tip from Joe about how to do massage off-site, out of the office, how to work with teams, and it's a quick tip. So look forward to that. We look forward to working with you. We have lots of things in store, and again, join the forum, talk to Joe online. You can send him through the forum any questions you want. We'll try to get back to you and give you the appropriate answer. All right? Again, thanks for joining us for Massage Training Plus. Joe Palumbo, Alvin Brown, and we'll talk to you soon.